My name is Greg. I'm the host of our webinar today, joined by two excellent colleagues from Titan Health, who I'll let introduce themselves in just a moment. This is meant to be a great discussion. We hope you brought a lot of questions. Please post any question you have in the chat. We want to get to all of them. Today is about AI and revenue cycle management. It's a topic that a lot of our clients are asking us about. Yesterday, there was a news release from Qualtrics, a company that focuses on customer experience. They interviewed health professionals who said that AI, automation, and revenue cycle management were top focuses for 2025. So we know it's top of mind for many of you as well. So we hope this will be a great opportunity to get some advice, some perspective, some use cases to get your questions answered. Many of the people who wanted to join today had a conflict, so we are recording this and we will post this. We'll send everyone an email link after the webinar so that you can access it to look at the transcript, to see some of the questions again, or to forward it to colleagues. Again, please ask all of your questions in the chat. There are no slides today, no pitch, just an energizing discussion. So to start, I'm going to have my two excellent colleagues introduce themselves. And I'll start with Nicole and then pass it over to Greg. So Nicole, welcome. Thank you for joining us. And please go ahead and briefly introduce your role at Titan Health and what you focus on.
Thank you, Greg. My name is Nicole Helfrich. I've been with Titan for just over 17 years. During that time, I've had the opportunity to wear many hats and work in different areas. And that's given me the opportunity to work with so many of our clients. I do have experience on both the provider and payer sides, but my primary focus here has been in client services. So helping our clients and organizations recover the revenue they're owed so they can reinvest it into patient care.
Thank you, Nicole. And Greg?
Yep. Hey, Greg. I'm Greg Robinson, Chief Technology Officer with Titan Health. I haven't been here quite as long as Nicole, but I strive to over the years. And I focus a lot on the engineering, a lot on our client data, and maintaining its security, ensuring that our operations folks, people like Nicole and her teams, are able to process and audit our data, as well as work on the strategy side to really help Titan to help their clients to get to the next level in terms of both revenue recovery and also understanding best practices in and around their data.
Great. Thank you, Greg. The other Greg, the more important Greg today. The first thing I wanted to do was just ask Nicole to briefly outline the areas of revenue cycle management that we focus on and spend the most time on. And the reason for that is I know it's a broad topic, and we wanted to try to talk about the ways that AI and automation over time might have an impact across those different areas. But could you just briefly describe what you work on, maybe the area you spend the most time on? That would be great, Nicole. Thank you.
Yeah, we currently support our clients in a variety of RCM aspects, so that can be pre-bill or post-bill. We're involved in some aspect in every capacity, starting with eligibility and benefits, coding and billing, some post-bill submission tasks. So this would be like your accounts receivable, and then we end with zero balance audits. We also do some special projects that don't fall into your standard revenue cycle management flow. These could be things like capital cost for new hospital builds, DRG transfers, and some specialized denials management projects.
All right, and thank you, Nicole. Just a small number. There's a very broad remit, which is why your expertise is so great, because you can cover all of that. So Greg, a question for you, and I think this is one of the questions that some of our clients have been asking. Is any one of those areas a prime candidate to maybe get started with AI, or in terms of how Titan Health is thinking about technology, is one of those a starting point for AI or automation, machine learning? Or do you think more about applying AI, machine learning, and automation across all of the different service lines or workflows?
Yeah, it's definitely across all of the service lines. The beauty in that is a lot of our data, almost irrespective of its nature, zero balance, ARR, special projects, all really come from a lot of the same data elements. We just use slightly different flavors of the same data sets. But once we've ingested and then curated this golden data set, so to speak, then it's really available for use across a number of potential use cases, in and around predicting denial management, claims auditing, anomaly detection, which is really important also for zero balance claim analysis. We could even, from an automation perspective, get into real-time coding automation. So really, we really serve at the behest of Nicole, her strong direction, our clients, their needs, but AI and ML kind of overall, when you think about what the power of machine learning, and it's really just applying it to a well curated and secure data set so that we can really understand the patterns, the underlying patterns and the clusters that are going on within the data.
Thank you, Greg. And a related question that came in prior to the webinar event from one of the attendees who's going to watch it offline was around HIPAA compliance. We have the Titan Cloud now. A lot of this processing work that we do will be done in a cloud environment that we're configuring, or that maybe some other people, some of our clients may configure as well. Is there a concern around HIPAA compliance when you're processing, the work that Nicole's doing in a cloud environment? How does Titan Health think about that?
Yeah, having our data processing in a cloud environment, specifically Azure, whether you're using AWS or what have you, really actually it helps to enhance security, because you don't have to necessarily worry about having a massive infrastructure within the company focusing entirely on security. A lot of the actual cloud management services themselves, once you step into an environment like Microsoft Azure, a lot of the security components are baked in. So it helps, with a lot of the regulatory compliance. It helps with SOC 2 certifications and such. At Titan Health, we prioritize security and compliance really every stage of data ingestion and development and use of the data. HIPAA definitely is at the cornerstone, and our infrastructure includes really a strong blend of advanced encryption, continuous monitoring. We have robust access controls, as well as role-based security and comprehensive audit logging. So a lot of this, when you start to compose and create a lot of your various components that sit, or the various servers and services. So as an example, we plan to later this quarter be releasing a FHIR interface, so fast healthcare interoperability resources. And in and amongst doing that, it is a server technology that really enables the transfer of data between Titan and our clients, and vice versa. Doing that using Microsoft Health Services, which now embeds an entirely HIPAA secure server, as well as a robust monitoring, the robust audit logging. I mean, it really has been a game changer. So moving to the cloud overall, and I think this is really what also has helped to propel the use of AI, particularly within our shop, because it's been that nice blend of really what's happened in the cloud computing world, and particularly again what vendors like Microsoft and AWS and Google Cloud Platform as well has curated into a nice offering.
Thank you, Greg. Nicole, sort of backing up a second, one of the questions that also has come in, but I think it ties into what Greg sort of covered, is when you get started onboarding a new client, I know one of our core tenets is we don't tell them that they need to change what they're doing or rework their files or suddenly configure their systems differently. That's right? We can work with the data, the formats of systems they already have. Is that your experience, and that sort of how things work day to day when we start with a new client?
Yes. Right now, it is a very manual process for not just Titan, but our clients as well. And the more time it takes to onboard, the more delays there will be in having us work their accounts and improving days to cash. We will be able to take targeted underpayment and suspicious claims more quickly once we start implementing some of these things internally. Then we'll have data-driven approaches on best collection practices, and all of this just maximizes revenue and faster days to pay, for sure.
Thank you. So Greg, I guess the question that I think people may have is, does what Nicole's talking about in terms of onboarding new client or getting started or sort of upgrading your RCM practice with a provider or a service provider like Titan Health, does that have to change how you would do that with the new AI and automation capabilities that you're building? Or can this be done in a flexible way so ultimately the health system or hospital doesn't have to sort of rework its workflows or reconfigure its systems? And Greg, how have we been thinking about that?
Yeah, so the overall, when we're taking the data in from our clients, again, and this is in part why we're moving towards FHIR, which is it's more of an enabler for the AI side. But when you consider FHIR or consider a standard practice, a health system overall, they're looking to do a lot of massive amounts of billing, right? They're seeing patients, their EHR is basically a massive billing machine. Those data go off to the payer. They get adjudicated. Whatever happens, we get involved. At the time when we get involved, we're basically, delivered a massive data set that we have to do something with. And the quicker that we can rapidly do something with that data set, that's kind of where AI goes in. But the quicker that we can actually ingest those data, that's really where something like FHIR comes in, and where we've revamped our file specification of our data needs from our client. We try to make it as burdenless as possible, and which is, again, why we're moving towards FHIR, because now it just simply becomes a simple handshake. What's your endpoint server? Can you, whitelist our server? And then great. And then everything else, easy. And then we're able to rapidly ingest a lot of the data in real time and then feed it through our predictive engines and our various machine learning and AI automation tool set through our core platform Metis, and really produce magic for our clients.
So someone who, maybe has less technical background or expertise, or maybe a revenue cycle executive with a health system or a hospital, if they're thinking that they know that there's a promise out there, they don't have to think about this like they might think about deploying a new ERP or a new accounting or finance system. It's not, they don't have to deploy a new system, right? It's just new capabilities being offered to them. And sort of our end, our background, our platform does the heavy lifting. Is that the right way to think about it?
That's definitely the right way to think about it, Greg. So, in our two standard forms of how we get our data, we might request, a file from our client, and then again, moving towards FHIR itself. All of that pretty much is the extent of their obligation, or what we really require from the day-to-day perspective. They don't have to load new software. They don't have to administer really anything. It's more so provide us your data, or in the case of FHIR, just handshake our servers, and then leave really the rest to us. And then our operations team, our client success team, really at that point engages from both the audit and the collections, and then the interfacing with our clients to not only help deliver on the actual promise of the zero balance recovery, et cetera, but also delivering on, more integrative knowledge about, here are some of the areas where you potentially can improve as a result of our analyses and our services.
That's a great, thank you. I hope that's a great answer for people who are hoping to get started sort of with AI. It's not a new, there's nothing that the IT team has to do for the health system or hospital. Nicole, a question for you is, I understand one of the key things that you and your team spends time on is actually knowledge transfer, helping the clients that we have improve their practices and just get smarter about things to look for. Can you just give some examples of how you do that?
Yeah, one of the things that we'd like to do more efficiently is, for an example, with a accounts receivable line of business for one of our clients, we would love to have the ability to guide our teams or their teams on when to take the next best action. Right now, we're just taking actions on accounts for the sake of taking an action, but we're really trying to determine when to take the right action. What is the right action and when is the right time to do that? And that will help push accounts towards resolution. Everybody's time will be better spent, less days to pay.
And thank you for that. And one of the reasons I asked that question, Nicole, and this goes back to Greg, is one of the questions we have gotten from clients is, now, do I need to upskill my teams on AI? Do they have to become more technical? Do they have to learn something new? Is that going to be something that Nicole and team then have to add to the knowledge transfer and training they have? And I guess, Greg, how would you answer that? Does if you're the CIO or CFO, revenue cycle executive for a health system or hospital, does your team need to go find sort of these hard to hire, hard to find, expensive AI experts to take advantage of these forthcoming capabilities?
Yeah, I would say in terms of the services that we provide at Titan, no, I think it's definitely best left to us. I remember back in the day in business school years ago, one of the core tenets you learn is, never outsource your core competency, but be happy to outsource, areas that aren't your core competency. If you're a hospital, health system, your core competency is provision of care, really looking after the patient, and providing strong clinical care, and outcomes and diagnosis of treatment. Everything else becomes one of these ancillary tasks that if you can offload it to experts, you should be. And that is where we excel and what we focus on. We really focus on the aspects of AI and AI, to dispel the myth, it's not magical, right? It's literally the intersection of a lot of hardcore math, and then computer science. And it definitely takes years of experience to really learn the right type of algorithms. The beautiful thing in computing over probably the past 5-7 years or so, maybe even 10 years, has been the advent of what's called libraries. And these accelerator libraries for programmers make it incredibly easy to do a lot of machine learning type of coding. The problem, though, is the lack of knowledge when it's not actually, because again, it's really the intersection of coding, which you can learn, it's a language, and math, which, as you know, if you're a mathematician, that just takes years and years and years and years. And you really have to understand, looking at the data that's in front of you, the diagnosis codes, the procedure codes, the facilities, the complex arrangements between the, division of financial responsibility that happens at the payer level. And you're really trying to understand what are actually the right type of mathematical models that I can code that's going to produce the right type of machine learning algorithm so that I can have the right understanding around prediction, denial, analysis, and then getting to better outcomes and getting to better times of cash and revenue recovery. So, it takes a lot of study and a lot of application. And that's really where we're investing our resources. So bring it back to your original question, as a hospital or health system or provider, do you want to invest in that? You want to invest in it to the point where you can analyze and understand some things about your claims, but to create it as an intrinsic business flow to really get after a lot of, what Nicole has described, which is a very complex set of processes around auditing, compliance, and improvement. It's difficult, and that's really where our expertise lie and where we invest our resources.
Great, thank you for that. A related question, and this came in prior to the webinar, and I bet this is a question on a lot of people's minds. Maybe people don't ask it because they feel like they should know, but someone asked, can you explain the difference between AI, machine learning, and automation, or are they all one and the same? So I hope that's a helpful question for everyone. And I think it's relevant because those terms do get used quite interchangeably.
Yeah, I'm happy to answer that. In fact, Nicole and I were just having a conversation about this fairly recently. At a super high level, automation, or really what a lot of people are talking about in terms of AI. Automation is really just creating technology-driven processes that perform repetitive tasks in a systematic manner. So you're really reducing the manual effort around that. AI is, by contrast, it's really utilizing algorithms, which can include machine learning, but to mimic human intelligence. Um, AI is really more when you think about the automation side. I don't know if you've ever seen anybody knows have ever seen those really cool Boston Dynamic robots. I think the latest one is called Atlas, and they do flips. It does parkour. It's amazing. It is the amazing intersection of mechanical engineering and AI. Right, a lot of potential automation is built into that. When you think about machine learning, that's actually taking in large data sets, and then understanding the patterns within it, and less so mimicking human behavior, but more so mimicking how human thinking and reasoning and logic gets you to a distillation of what those data are to something that we call meaning and definitions.
Perfect. Thank you so much. I think a lot of people will appreciate that clarification. I recently did some work for a financial services company that was getting into insurance and insurtech. And one of the findings they had was their initial use of AI could reduce claims processing for sort of retail or consumer-based insurance by 30% or more. And I'm just curious, Nicole, I'm not trying to lock you down to a number, but
Mhm.
you already kind of live in that world of faster time to recovery. Um, is that something that sort of you feel is within reach when you think about the potential of AI is, faster claims processing, or do you think it's more about the volume that can be done in the same amount of time, or maybe a little bit of both? And again, they're not trying to pin you down on a number,
Yeah.
but any reflection on that?
Yeah. Are you speaking about claims processing from a payer side or the accounts that our team is working through?
More the accounts when you engage with the
Yeah.
clients that we have.
Yeah, I definitely believe that it's going to increase. I will not commit to a number, but it's all about working more efficiently and working the right accounts. It can be as simple as grouping like accounts together, using bots to go out and put us in a queue with the payers. Learning payer behaviors and being able to loop like claims together will only increase our efficiency. So I won't commit to a number, but I do believe that we will be touching accounts faster and getting the days to cash, getting it faster. Yes.
I'm optimistic about that as well, based on what I saw
Mhm.
in the insurance industry and
Mhm.
what's happening in so many other industries. Greg, back to sort of the idea of the use cases that and sort of service lines that Nicole spoke about. Um, when you and your team are putting together the new Titan sort of cloud platform and upgrading the meta software and not ingesting, but infusing more and more AI automation and machine learning capabilities, Greg, is there a single workflow that your team is focused on first, or, you know, are you able to do things that help, account AR and recovery or zero balance or capital costs? Are you able to address all of those at the same time? And the reason I'm asking is back to the question that was asked earlier. You guys touched on this briefly. If I'm a health system, a hospital, is there one place I should look for getting new efficiencies like Nicole addressed first? Now that we've had some additional context, do you have any additional thoughts to offer on that, Greg?
We at Titan, and particularly in the data engineering side, we focus a lot more on the curation of data, that can then help multiple lines of business and multiple problems that come up, or questions that come up from clients or questions that come up from our operations team. Everything, in and around machine learning, AI period is the function of having well curated data. Kind of without that, it becomes a hard stop. So I think a lot of what we focus on to kind of make that quote unquote magic happen is really ensuring that, well, obviously first that the data are secure. We've got that part handled, but then it's really clean data. I've worked like Nicole on the payer and provider side for a number of years, particularly in my health system days. I can tell you, a lot of data just gets dirty. We configure our EHRs to do what we need to do. We need a template for this infectious disease, which is different, from this workflow and outpatient, what have you. And as we do that, and as we develop our hierarchy, it's no different than any other industry, like in using an ERP. Over time, the more you configure your system, unfortunately, the dirtier your data becomes. And we have to try to unravel that once we receive, client data, and we do a great job of that. And we partner with our health system clients who do an amazing job helping to unravel a lot of those data. But still, a large part of just getting to the point of cogency, getting to the point of delivering answers, is all about curating those data. So I think we're able to answer a lot of questions simply because that is the focal point of our data engineers and a lot of what we do on a day-to-day basis. A lot of the machine learning and everything else flows more naturally from that. But again, not to be flog this in any way, shape, or form, but that's also another reason why we are moving to FHIR, because we need to really enable getting at clean data elements as they're stored in the EHR in real time, and bringing them over into our environment, which then reduces both the administrative burden on our client side, but also on our side, because it's less data curation and more really just getting directly to manipulation and answers.
Thank you. Another question that came in. So if you have sort of experience as a IT executive or maybe a revenue cycle management executive with systems, with technology, maybe your context is there's certain version upgrades where suddenly you have a capability you really needed, or it was the right time, or the integration you were looking for is finally available. How should people think about a company like Titan Health, who has now its own platform, the Metis, which is getting infused with rich AI, machine learning, and automation capabilities? Is there a point in time which people should say, okay, now I know I can take advantage of this? Or, how should they think about the fact that you're continually adding capabilities over time? It's cloud-based. There aren't sort of version upgrades, but also AI gets smarter through its own use of math, as you described earlier. Like, do people need to wait for a certain milestone, or is the work that Nicole will do with her team providing data into Metis something that just continually gains more capabilities without having to sort of wait for certain milestones, like the upgrade that you'll do in July or in October? Does that make sense? That was sort of the question that came in.
Yeah, no, it does make sense. So our shop, we work in an agile, using agile methodology. So there are a lot of incremental builds, a lot of incremental change, and we do a lot, kind of standard agile, where there's continuous integration, continuous delivery of the work product of what we do, and that's both on the data engineering side as well as the software engineering side. So there are a lot of changes or improvements that happen really just week over week. We don't go for the big bang. I mean, I remember years ago working at a health plan, and we were commissioned with developing a data warehouse, and it was literally a conversation in which I remember my director of IT at the time said, "All right, give us 3 years and we'll have it done. And don't bother us until it happens." Now that's super old school, but that was the way. And after those 3 years, a lot of what was built is now 3 years old and aged. So moving to an agile method, which is what we have, provides for more incremental. So it's literally week over week, you see another kind of incremental change. This benefits, or the how this is seen, I think, from a client side, is more so that a lot of the efficiencies that we bake in, or a lot of the data improvements or software improvements, are now reflected more so on the operation side. So they're able to produce their analytics, produce their reports, produce their auditing, and their collecting incrementally faster week over week.
Thank you. That's very helpful. You can see there's a group of questions that I think sort of come from this context of an ERP or NetSuite. There's some system that people have deployed, and what you're describing is very different when there's a cloud-based system and you're just constantly infusing it, and people just will gain the new capabilities. They don't have to wait for a certain timeout or a certain milestone. One other question. And again, we won't hold you to the number, Nicole, but do you have a sense for how many insurers, payers, like across all the clients you work with, we see? Is it, hundreds, dozens?
Hundreds.
Hundreds, yeah. And the reason that I'm asking is a question came in, like, will Titan Health with our platform and just with AI in general, will in revenue cycle management, Greg, will you have to do specific things with each payer, right? Do you have to tune the machine learning or other steps like that? Or can the system kind of look at all of the data that comes in the different formats or approaches from the payers and insurers and figure out how to best work with that?
Yeah, so that probably falls into the category of what we have planned on the roadmap for a little bit later this year, the next increment, actually version 4.0 of our system, which includes a large language model processing of a lot of those data. So using generative AI, we're able to distill down and understand, the literally hundreds or so of contracts, and if you distill down in contracts, you're talking about multiple tens of thousands of individual terms that also have a temporal nature, because they only it's only as good as the life of the contract, or the rate sheet itself. So there are a lot of complexities to understand the nature of any particular encounter or claim, and that needs to be placed in the context of the contract itself. So, and that's, again, where the beauty of machine learning comes in, and exactly where a lot of our existing machine learning programs that we've put in place, particularly recently, do a particularly good job. But the next release of our product plan for later this year, including that generative AI large language model component, really will get at those data a lot quicker and coaching.
Okay, thank you so much. Are there any questions from our attendees today? You can post them in the chat. We covered, I know, a lot of the questions that came in leading up to the webinar, but any last questions? Looks like we've got one coming in. For a client of a company like Titan Health, does all of this new software development work mean that clients would experience delays or slower results? Like, is this sort of new capability likely to result in perhaps a gap so that the system can sort of work its magic?
Yeah, no, and again, getting back to the agile method and using CI/CD, continuous integration, continuous deployment, it means that we don't experience slowdowns. Again, I would say any slowdowns that we encounter is really more so on the data engineering side, when we're just trying to unravel those data as we've gotten them in. But from a software development perspective and incremental deployment of software, no, our clients won't see issues in that manner.
That's great. Thank you, Greg. We have another question coming in. We are going to try to wrap up a little early, give people some time back, given it's a busy week, I think, for many people. Will AI improve onboarding of new clients in terms of time to results recovery? And again, we already avoided putting Nicole on the spot on the number. We don't do that, but what do either of you have a perspective on this? Like, should ultimately the measure of this be faster time to revenue recovery, or is it capacity, or is it both? Nicole, any thoughts on that?
The fast answer is yes, it will improve times to results and recovery. It's a very manual process right now, onboarding clients, but once things can be more automated and efficient, we get to the accounts faster, we identify the opportunities faster, and then are more efficient in our follow-up process.
Thank you, Greg. Any comments or perspective you'd like to add?
Yeah, no, I'd echo that. AI significantly streamlines both the onboarding and the delivery of results. Because it automates time-consuming processes, or what we're doing. Helps to automate time-consuming processes, particularly around the data ingestion process, validation, and then workflow itself. As it processes through our system.
Okay, thank you. Well, with that, I just want to say, first of all, a big thank you to Nicole and Greg for all your time and answering all of the questions that came in. Looks like we have one more. While that's coming in, I wanted to mention Nicole does boot camps with HFMA. So if you are a member of that organization or attend events, you can learn from the deep expertise she offers. Greg I can put you in touch with him when we send out the recording, link to the recording. I'll put some contact details. Whether you want to work with Titan or not, I know Greg would love to talk to you about AI, automation, machine learning, answer all your questions. And we have a whole team of people who can help do that as well. Last question. Do I need to add AI expertise to my in-house team? Really for Greg, probably.
Yeah, I'm happy to answer that. Again, I would say no. There are adding a data scientist, I would say definitely helps. It's just a new advancement of what we used to call business intelligence analyst, or, a data analyst, but somebody that has, more of that cursory knowledge of that, of statistics and how to program around that for your data. If you're in-house at a health system, definitely helps. Do you need to go down the machine learning engineer route, such as we've done at Titan? No, and again, that's where, we're really investing in that as our core competency, and investing a lot of resources in that. So I would say no, add us to your team and we can help out a lot quicker.
Thank you so much, both of you, for your time and answering all the questions. If you have additional questions, look for our email. We'll send out a recording, ways to reach us. We will gladly answer all of your questions. Hope everyone has a great close to the week, a great weekend ahead, and we look forward to continuing the conversation. We'll have another webinar towards the end of April. We'll announce that soon as well. Thank you, everyone. Have a good day. Good afternoon, everyone. Good morning if it's still morning. Bye-bye.